This morning we're talking about osteoarthritis. Did I get that correct?
Yes, osteoarthritis.
Okay, so let's just dive right into it. Please, Harry, can you describe to us what osteoarthritis means or what it is?
Okay, so basically, osteoarthritis is a type of arthritis, and it's the most common type of arthritis amongst other types of arthritis that happens to individuals as we age. Alright, so it is very dominant in this part. Just as a matter of fact, about 60 to 70% of older adults are prone to osteoarthritis.
Okay.
It's a joint degenerative disease that actually showcases with presence of pain, swelling and stiffness amongst other symptoms that it showcases, and it is automatic. It's like they call it autoimmune disease. It's something that you don't have to fall sick to get it. As we grow older, we encounter it. We're prone to get it. For persons that are obese, that have weight, too much of weight, so they are prone to get it. And this joint degenerative disease happens to, let's say, our hip, our lumbar spine, our cervical spine, which is our neck. Our hip represents our lumbar spine.
Okay.
And then we have it in our fingers.
Okay, I was just going to ask you what are the most common symptoms. So you're saying that your neck, your hip, your fingers.
So these are the areas, these are the joints.
Okay.
Your neck, your fingers.
Okay.
Your hip, your knee. Yes, these are the areas that you begin to experience this osteoarthritis. However, people that get it, if you are 50 years and above, almost anybody can get it. But for some reasons, it is more of women that have osteoarthritis, and women that are up to 50 years, and sometimes it happens to women that have experienced menopause. Yes.
All right. Okay, so let's talk about some of the risk factors. So generally, you said the causes are generally if you are, obese.
Yes, and yes, amongst those ones, you are obese. If you also have from a family that your genetics, you have a family history of osteoarthritis.
Yes.
The tendency you are going to get osteoarthritis is high. If you're not carrying out any form of physical activity, the tendency you get it to.
I'm glad you mentioned any form of physical activity. So someone in his mid-20s, mid-30s, or someone in her mid-20s, mid-20s, what can they do ahead of time to prevent such things, especially when you mentioned that it's genetic?
So most of the times, people that have osteoarthritis are obese. So if you're in your 20s, you're a young person, you're a young adult, and then you are obese, the tendency that you're going to have osteoarthritis is high. Because what is osteoarthritis? Basically, it is the breakdown of your joints. It is autoimmune. You get to some point in life, your joints begin to wear off. They begin to break down. Now in your joints, we have your cartilage, we have your tendon, we have your ligaments. Your tendon joints muscles to bones. I want you to understand this. Your ligaments joins bones to bones. Now where the bones to bones meet, at the edge of the bones where they meet is where your cartilage is. Now your cartilage makes those bones come together for better friction. Now what happens when it wears off, when it breaks down? That means that your bones will begin to touch itself. When you begin to experience this, pain follows. So it is an excruciating pain that people undergo at some point in their life that happens to them most of the time in the night. Most of the time if they haven't carried out physical activity. Most of the time if they carry out physical activity wrongly. You get the point now?
Okay.
So all these are things that actually showcases. But then again, physical activity is a very good way to modify your lifestyle so that you can manage the symptoms. Because for osteoarthritis, it is one of those diseases too that don't have cure. You can only manage the symptoms. So it is always good you go for medical examination. You make observations of yourself and you know all of this early enough.
I'm glad you mentioned that because I was just about to jump to treatment options, but you mentioned that it doesn't have a cure. But what are the ways to manage it? At the same time, also, as far as medication, physical therapy, lifestyle changes is concerned, what are the things you can advise that individuals should do?
So I'm coming from the fitness aspect, where we can use physical activity to manage osteoarthritis for those that have, and also where you can engage yourself in physical activity and avoid any chances of getting osteoarthritis. Because when you carry out physical activity, what happens is this: you're going to develop more functionality with your joints. If you have osteoarthritis, you are being able to move correctly. Imagine climbing stairs and your knee already hurts you. Your bone is touching itself at the joint. If you're unable to move very well, it leads to depression. So when you carry out physical activity is going to help for that joint to begin to, you build muscles, yes, around the joints. It helps for better mobility and functionality, so you can move very well. It will also help you to lose weight, because when you lose weight at those joints, it will reduce swelling. When you lose weight at those joints, you're not going to put more force for the joints to carry your body. When there's more weight, there's more force at that joint. So you need to ensure that you are carrying out weight loss activities, so that your joints will be stable and you'll be mobile enough to work very well. And fitness also helps to release hormones like endorphins, which is the happy hormones. Because imagine undergoing that kind of pain. You can think about the level of depression people that have osteoarthritis will be undergoing. So when you carry out physical activity, it helps you to release endorphins in your body, which makes you feel happy.
Let's quickly talk about two things really. Let's talk about patient stories and case studies. I'm sure that you've worked with a few people, so can you just share, without mentioning their names, can you just share with us, some of the case studies that you've worked with? And
of course.
Also, if there is a future for research on how to put an end to osteoarthritis.
I tell you that about 60 to 70% of our older adults have osteoarthritis, so you can imagine the kind of people I work with. For people that have osteoarthritis, one thing is, the level of pain they undergo, it makes them, they also wouldn't want to carry out physical activity.
That is true.
However, it is a way of modifying your lifestyle so that we can manage the symptoms. When you get to realize that you have a pain that literally has no solution, it has no cure. Now, aside using pharmacological approach, you take medication that has a whole lot of calcium, you take medication that has anti-inflammatory agent, antioxidants, your vitamin E, your fish oil, and the rest. Fitness is something that you have to involve yourself in. Now, when you're involving yourself in fitness, you need to do some cardiovascular exercises almost every day. Exercises that would not stress you. Exercises like cycling. Exercises like walking. Exercises like swimming. You do them for a long period of time, but then they don't put stress on your joints. You also carry out weight training activities where you lift so as to enable you to build muscles. Okay. When you build muscles around your joints, you have more mobility, more functionality, and you also incorporate flexibility exercises. So bringing all of this together as a lifestyle modification is going to help you to reduce the pain, it is going to help to reduce the swellness, and it is also going to help to eradicate it, not totally, but then at a level where you can also carry out activity of daily living without complaining of too many pain. Alright. So another thing you also know is persons that have osteoarthritis have a pattern of eating. Okay. Yes, we have the Mediterranean style of eating. Nutrition or food that involves your olive oils, fish, vegetable, fruits, nuts and seeds, and even beans. So when you eat this type of pattern of eating, which is called the Mediterranean style, it is going to help with your joints. So this, coupled with lifestyle changes, which is your physical activity, will help you to mitigate the risk of attaining osteoarthritis or manage osteoarthritis with the symptoms that I've already showcased.